I'm interested in understanding just a little bit more about your colleagues' reaction to Twitter, because I get it all the time.
Oh,
it's like, Twitter, I
priceless.
don't want to do that. It's almost like appropriate use of Twitter, appropriate use of antibiotics.
So when we have an infectious disease conference every Wednesday, and that's where our physicians and infectious disease pharmacists, we would present interesting cases. Things, maybe a patient still in our hospital that is complex, and we want everybody to kind of weigh in on how to manage the patient. So one of those, I said, I'd like to present a topic discussion called Twitter. If I could describe the reaction, it's like, are you serious? And I'm like, no, 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 this is serious. I'm not kidding. And it was, let's just say, not real well received. They're like, wow. So when you don't understand something and you don't see any value in it, what do you do?
Exactly.
You just go, no. And most infectious disease clinicians that I try to share the value of Twitter with, they see it as another email, and we're so inundated with emails. I can barely keep up with them, and so who wants another email to deal with all day? You can't even keep track of the one you've got. So I say, trust me, it is not email. And they ask me, Debbie, how do you find time to do this? Because I am very busy, like most people are. And I said, you know, you always find time for the things in your life that are valuable.
So with that thought, you had said something earlier that I think is extraordinarily and very powerful. The first is the value of a tweet, just a single tweet, right? The power of an idea, right? And then the utility of Twitter as a search engine. And I think that we've talked about that a lot. That's a big area that I use. I try to get that as the cognitive tipping point to get people to embrace Twitter when they know how to use it. So that's
not well understood. Explain that in more detail.
So to me, people say, I have nothing to say. That's the first thing I hear. I have nothing to say. Who do I tweet to? And then I've got no followers, which is even worse. It's almost embarrassing.
I felt that
right?
way.
I have no followers. What am I? But for me, if I want to know what's going on in the world now, whether
that's the
I'm
key,
at whether I'm at ID Week, AHA is going on right now. What a wellspring of information. If you want to follow some of the cardiology tweeters or even just the AHA hashtag, and we'll talk a little bit more about what a hashtag is and how to use it, but to me, I know what's going on in the world right now. So if I Google AHA, I'm going to get like nonsense. I'm just going to get reams and reams of data that I can't make heads or tails of. But if I go to hashtag AHA, I know what's going on right now, and then I can even prioritize my search by not only what's happening now, but what's the top trending tweet. And I know that they're talking about X or Y. So for me, that is one of the most valuable tools for Twitter. It's a search engine. If you use Google, you should be using Twitter, in my book.
So World Antibiotic Awareness Week is in November. And it is really the stewards around the world trying to reach people. The most useful vehicle is Twitter, and that is what the Centers for Disease Control is on it, the Society of Infectious Disease Pharmacists, the Infectious Disease Society of America, the European groups. People around the world have a coordinated effort around a hashtag. So, John, you're right. If you want to become involved in Antibiotic Awareness Week. And oh my goodness, our CDC does an amazing job. They have educational,
CDC.
Professional artists designing posters that any doctor could go put in their office. And that's hopefully what they're doing. I don't have time to design that stuff, nor am I a graphic artist. They have professional people creating tools for us to use. You can hang them in your hospital. You can hang them in the healthcare clinic. The veterinarians, the One Health concept, you know, we prescribe a lot of antibiotics to animals. That's a whole nother story. But it's a coordinated effort around the world. I mean, how many efforts take place around the world that are coordinated?
So interestingly, you know, you referred to Twitter as knowing what's going on now. I also find Twitter to be an amazingly quick analysis of what's going on now. So I don't need to spend a lot of time on Twitter. A couple trending tweets, a couple big ideas, and I get a sense of what's going on in a specific category. So I think that's another area.
Well, it reveals a lot. If we're on World Antibiotic Awareness Week. Part of what we're looking at is, who are we engaging with? Are we preaching to the choir? We're tweeting to each other? Or are we actually reaching consumers, patients, the non-infectious disease experts, surgeons, hospitalists, critical care physicians? And so I have a strategy on how I tweet, because you're right, you can tweet and you go, well, who's reading this? And I don't know. But if I include you in my tweet, I know if you feel what I tweeted to you is important and provides value, you're going to tweet it to your network of people, and you reach
so that's
a huge
that's
amount
the power
of people.
of the retweet.
Yes, like by knowing you, I now reach a whole different avenue of people, and a lot of them are not in healthcare. That's exactly who we're trying to reach, and you're the one that has that voice.
So in a way, I think Twitter offers I don't want to use the word private, but there is a private dialogue. So you tweet something, you include me, and you include a few other people as sort of almost a dialogue among us.
Yes.
But the point is not only to educate us, but to provide the basis for broad-based dissemination.
Right.
I'm honored to be followed by someone like Mark Cuban.
Yeah.
Millions, tens of millions of followers. John Scully from Apple.
Right.
Interesting people
So
that
your
that
circle is totally different than mine. But imagine I tweet something really responsible about, let's say, a MRSA infection, methicillin-resistant Staph aureus. Anybody can get that. You cut yourself. Staph is on our skin, but you can get an infection with MRSA. And there's only a handful of effective antibiotics. So let's say I tweet something about that, and Mark Cuban, his son, happens to have MRSA, and all of a sudden...
all the athletes that he's connected to.
Exactly. I mean, athletes get MRSA. We can name so many athletes, football players, basketball players, whose careers have been ended because of MRSA infections, or certainly sidelined. All of a sudden, Mark Cuban, who I've never met and don't know, I watch him on Shark Tank, but he might retweet my tweet because now it's personal to him. He's personally, his team had MRSA and his best player got sidelined. There's a personal connection now, and I would never probably have him retweet it, but I tweet it to you, who he has that personal connection with. That's so powerful.
There are networks, broad-based networks, but there are also, clusters of tweeters, the people who know each other. And, I'll often ask for people to retweet things. I'll say, this is important. Please retweet this. And they may not be an expert, but they may have a really interesting audience. So it's the diffusion of innovation. It's the diffusion of timely.
And I love the fact that, people don't think the topic of antibiotic resistance is important to them because they've never had an infection. And I tell them, I'm going to guarantee you, if it's not you, it'll be a family member, your grandparents, your parents, or your child. And then this topic's going to become personal, because when your loved one is in the hospital and does not have an effective antibiotic because we've overused them and then none of them work, and you're like, what do you mean there's nothing to treat them with? That's kind of the mindset of cancer. Cancer, every society values cancer because, oh my gosh, everybody feels sorry for somebody with cancer because we know the outcome with cancer generally is going to be death. And in many scenarios, there's nothing to treat you with. And so we want all stops pulled out. But infectious disease, society doesn't have that perspective. They don't have that value. It's like, oh, there's always going to be antibiotics, and antibiotics treat everything. So when I see a patient, and sometimes it's as simple as a 23-year-old college student at Ohio State coming in with her first urinary tract infection. Okay, so this isn't grandma 95 with 20 different diseases and dying in a nursing home. This is the 23-year-old who's never even been in a hospital. And I have to tell them, we actually have no oral effective agents to treat you with, so we've got to admit you to get IV therapy.
Wow.
The look on their face, and then their parents going, how did my daughter get that? That's the moment we're living in right now. And so to me, Twitter provides me a voice to get that story out there, and you are a vehicle to help me spread that story.
Interestingly, you talk about our connections to cancer, because almost 1 in 3 are touched with cancer, either personally or through families. Who has not had a course of an antibiotic?
Yes.
I mean, to me, that's the one drug that touches all our lives.
Absolutely.
From a beta lactam to complicated C. diff infections. I mean, they're rich in emotion and
But society also feels, because for decades, the biggest challenge in my field was keeping up with all the new antibiotics. There was like one every 2 months. Every day there was.
Well, that's
seemed
certainly
like there was
slowed down.
There was a new cephalosporin, and that was the challenge early in my career, is trying to keep on top of every new antibiotic. But pharma is a smart business, and they realized, and bacteria are real smart. Bacteria live to mutate and overcome antibiotics. That's their sole purpose. So as fast as we discover, the minute you start using an antibiotic and exposing the bacteria to that antibiotic, they're sitting there going, okay, we got to fight this one. This is a new class.
Exactly.
So, it's kind of dumbing it down, but you get the idea. It's like that's their job, is to finish fighting antibiotics and mutating. So pharmaceutical companies quickly became very, this class of drugs are really, from a business side, not a smart class to discover, because as fast as they get them out to market, they rendered useless due to antibiotic resistance. And then, it's a very complex problem. So, bacteria are smart, and they're doing their job. They're resisting antibiotics.